Good afternoon, guys. I hope we're all sparkly. As some of you may know, I've not been feeling 100%. Is 100% realistic in this day and age? No, but it's never been realistic because, as Vince Lombardi said, in the pursuit of perfection, you can achieve excellence. So why haven't I been feeling very well? Well, I've got a streaming cold and now I'm going to overshare. So if you're not a fan of oversharing, stop the video. I've had epididymoorchitis, which essentially means an infection down below in my testicle. Yikes. Horrible. I woke up one day with a testicle twice the size as it normally is. Now, that could be considered a good thing, but not when it's associated with pain. So I knew pretty much from day one that I had an infection. But us men, we're not very good at engaging with the healthcare system because we don't feel very listened to. And again, we're men and we need to suck it up, buttercup, and get on with it. But I needed help. So I've been on antibiotics for the last 10 days and it's been miserable. My guts are literally on fire. I have not been able to fire on 100%, 90%, 80%. But have I stopped working? No. Have I adapted my practice? Yes. Because we're all walking wounded, but we need to adapt and evolve. And the older you get, the more you realize that you can't go 100% all the time. You have to be considered. And testosterone allows you to be considered. As we've said before, testosterone counterbalances cortisol. And we should consider testosterone to be the calming hormone, the calm amidst the storm. So why am I oversharing? Well, I'm oversharing just to raise awareness that it's nothing to be embarrassed about. And actually, going to the GP and having my testicles examined, it's something I do to the guys every single time I see them at their new patient consultation. Because what happens? Your testicles produce testosterone. Lots of people from other clinics or the NHS have not had a testicular exam. With the primary role of the testicles to produce testosterone, and you've got low testosterone, why has this not happened? Why has due diligence not been shown? Now, you can make an argument for a prostate examination being more harmful than good if you're not very good at examining prostates. Now, disappointingly, again, I've examined more prostates than I care to think. But it's necessary because what are we looking for? We're not only looking for benign enlargement, we're also looking for cancer. So when it comes to testicles, as I said, the main role of the testicles is to produce testosterone and sperm for fertility. I have found testicular cancer on pre-screening. So this guy had been dismissed again before by a healthcare professional. And now he's had his testicle removed. Now he's going to potentially live a long and fruitful life on testosterone replacement therapy without a cancer causing obvious harm. So why are you not having your testicles examined when you go on TRT? Well, lots of you have gone online and just got testosterone online. And you've been reassured by the salesman that you don't need to have a physical examination. Every single patient at the Men's Health Clinic comes to clinic for their new patient consultation and yearly thereafter. The rest can be managed remotely. But I insist on an examination because we've picked up cancer. Why would you not want to know? Utterly horrendous. So you only have to have a basic understanding of the HPG axis. So the hypothalamus sends gonadotrophin releasing hormone down to the pituitary, and the pituitary sends luteinizing hormone down to the testicles to produce testosterone and follicle stimulating hormone down to produce sperm. Then the testosterone gets released and lots of it gets bound to SHBG and albumin, two proteins produced by the liver, and a small percent is free to be used. It's not just testosterone, is it? Testosterone also converts into estradiol and DHT. And those hormones, those 3 anabolic hormones, exert their effects on their target organs, and they also feed back to the brain to tell the brain that you have enough testosterone. So it's a negative feedback loop. It's a wonderfully complicated, yet rather simple in the same breath, system that allows you to get on with life. Again, this wonderful understanding of balance, anabolic versus catabolic, and your anabolic processes predominate at night time. So when something goes wrong, surely we should be looking to find out why it's gone wrong. We don't just look at the end result and go, well, I need testosterone. Why have you got low testosterone? So you may well have a pathology. And if that pathology goes unchecked, my God, your life will be shortened as a direct result of not showing due diligence. Whether that be as a result of your flippancy, or the flippancy of the online clinic, or the endocrinologist that's supposed to be an expert in hormones, not performing a physical examination. How utterly disgusting is that? So, I'm sorry that you have to come to clinic. I'm sorry it's taken 2 hours, 4 hours out of your day. Even our international patients from all over the world. We get a patient come from Singapore, some from Hong Kong. The list goes on. They understand that due diligence must be shown. And if you take the path of least resistance, sometimes it's not going to be a reward. Sometimes it's going to be utter devastation to your life. Now, we want to do is over-dramatize this, but it needs to be over-dramatized because it's not over-dramatizing, it's realism. And again, as I said before, at the Men's Health Clinic, you'd be told truths. I don't sugarcoat anything because it's not helped you in the past, has it? Essentially, we're fans of tough love, but empathetic love. You don't need my sympathy. You need practical solutions and ways of tackling your problems. And my job really is just to optimize your male androgen profile, but I can't do the rest for you. I can't make those positive changes to your sleep hygiene, your stress levels, your nutrition, your exercise. I can't change your mindset. Why do I do these videos? It's to impart hopefully knowledge and wisdom and experience to you guys. I've been there. I've come out the other side. I've come out the other side understanding that, again, Carl Jung's shadow. You must keep moving to the light, but the shadow is always behind you. And the only way that you can keep moving towards the light is what? By moving towards the light with an awareness of the shadow. So it is not a cure-all, fix-all, but you must show due diligence. You must then take personal responsibility and accountability and not get away with anything, because as you know already, if you've tried to get away with it, it's not worked, has it? Because all of your past indiscretions, have they had an effect on your now? Yes, 100%. So does that mean you're going to sit there and feel sorry for yourself and think, oh, the world has been so cruel to me, when you've actually caused a lot of harm yourselves? Well, you can. You can have that self-pity and that self-misery. And how do you feel? Not too good, do you? So again, it's about putting your big boy pants on and taking personal responsibility and accountability, looking at all those things that we talk about all day, every day, having the right mindset, deciding to see the glass as half full, not half empty, every single day. To do what? Yeah, you guessed it. Go earn your reward. And the reward is the effort that you're about to put in. So go do the work.